Governor, thanks so much for having us in your lovely office here. Really appreciate your time.
Thank you for coming.
Your probably your biggest win of the session was a new permanent universal childcare program here in New Mexico.
It's my big win in 8 years.
Yeah,
It's a long time in coming, and thank you for recognizing it as the achievement that it is.
No doubt. And, there was some back and forth throughout the session, debates, amendments. There was a call for wealthier families to pay copays. A version of that did make it into the final bill. How do you feel about what lawmakers got to your desk?
I feel really good. Look, my preference is still, you don't need copays in a system. It's not universal then. It can be better than it is anywhere else for access for working parents and families, but you create equality in a system, right? When everyone goes. And, public education, even for its downsides, and there are some here in New Mexico still, you want it to be available in the same way to everyone.
And so it's not. How does that feel?
So I didn't want it. But consensus is about productive compromise. So here's what they did. They said, look, if there's a downturn in the economy, right? States, including this one, have had to make really tough choices, including they cut education in the last administration because we didn't rebound from the 2008 recession for a long time. So if we have an economic downturn that's got fair measures, right? It can't be a moment, can't be one gas price, it can't have oil by the barrel drop to 50 for a month or two. These are sustained problems over a year. Then the department can institute copays.
Right, so there's these triggers.
There's triggers, and those triggers are at 600% of poverty. There's not a state anywhere in America that gets anywhere close to that.
How do the communities across New Mexico meet the new demand for now free or at least low-cost childcare? What does workforce development in this space look like?
Well, we are 67% to the good as compared to the rest of the nation. And actually, I want people who challenge us. And so thank you. But for every naysayer that said on November 1st, there is no way you can build this system when we have gaps. Well, 13,000 plus children later, I would tell you we did exactly that. And we did it by investing in a workforce at the same time, by doing the training at the same time, by allowing the certification of home-based providers, by not picking one kind of system like public schools or faith-based or private or nonprofit versus profit.
It's a bit of a patchwork.
It's everything. And I wouldn't say it's a patchwork. It's a smart design that allows parents to have choices and for providers to have the kinds of systems that they're comfortable in running and having available in a community. So we met the need. Now the second part, meeting the need in a much more flexible system. More certified workers, more in a career path, more new buildings for childcare, because we're learning things, the country is, the state is, about the best way to teach or support a 2-year-old in a brand new childcare system. There's different tools and techniques, and all of that gets built into a brand new structure, which is why we're paying for those structures and low interest loans. We're building as fast as we're delivering. I think New Mexico is the model for the rest of the country to follow, and I assure you that's happening.
And if that's the case,
Yep.
Let's envision the future after this is implemented. New Mexico has for years been too often at the bottom of negative lists when it comes to childhood well-being. What do you envision universal childcare to do to all of the various measures that go into that?
Well, we're already seeing what it's done. I mean, we did pre-K first, and we also then lifted, right? So we had free childcare for a lot of New Mexico families, because until November, we were at 400% of poverty. Right. So we're taking children and families out of poverty. We're number one in the nation for moving the needle further and faster than any state in America's history. So we were 50th, to your point, and now we're 21st. Right? It's all of these investments. The number one indicator for child well-being, whether it's going to be good or bad, is poverty. What happens when you're in poverty? Trauma, stresses, family instability, drug addiction, alcohol addiction, high risk environments. All of that gets attenuated. Is it always all gone? That's an impossible standard. But we are seeing those outcomes.
And so do you see that starting to trickle forward to our third graders, fifth graders, eighth graders with those different tests?
Yes. And in fact, we've seen bigger gains in New Mexico than the Mississippi Miracle in terms of what we're seeing in our grade schools in literacy jumps. Are we there? No. And did our mid-schoolers get free childcare and free pre-K? They didn't. And did our high schoolers? They didn't. So you're going to see gaps that we're working on. We're not ignoring mid-school and high school. That's why we now have it literacy mandated for everyone everywhere. But the things that you must have as a state, you must address poverty, you must address crime, you must address behavioral health. We're the only state in America that eliminated behavioral health access for, nearly 8 years in a state, and then had to deal with COVID. We got every kind of risk on top of risk that any state has ever had to deal with, and we've tackled all of it, and I am feeling better than bullish. Childcare really is about making sure that working families can stay at work and make the choices that they've always deserved to be able to make. But I believe unequivocally, to your point, I really want to hit home because you've been the first person to really get there. This is going to impact risk in New Mexico and child well-being. And we have waited 100 years to do all of the things all at once. You can't just do a piece of it. You have to do all of it. And then you have to sustain it. And what did this legislature do? They did it for 5 years. It's a 5-year funding model. They have to kind of say yes again every year. But we showed that we can fund it at this level for every infant, 0 to 3, for 5 years between general fund and the trust fund. This is something no state has ever achieved. And if I sound really like I'm leaning in and proud, make no mistake, I am. And I think bipartisan, the legislators who built this along this 8 years.
The Immigrant Safety Act was another really big bill this year. Counties must end their contracts with ICE for immigrant detention as soon as practical. Any word on whether private prisons, like CoreCivic, for instance, may contract directly with ICE and continue operating within the state of New Mexico?
I think with what happened in America and in Minnesota, I think the federal government is going to be careful about what they do. I can't promise New Mexicans that they won't try to do, private prisons. We won't run, the state won't contract with the private prison entity. We do it ourselves. We've taken over 2 private prisons, and I think our outcomes, in fact, I can show you the data, unequivocally better, as they should be, right? We have a constitutional duty to keep prisoners and inmates or folks in jail safe and to meet their basic human needs and to provide those services with dignity.
When we spoke to you during the session, you spoke with Gwyneth Dolan. You said if this step wasn't enough, you would find other ways to protect New Mexicans. How will you know if more is needed? And to your point about what the state actually has the ability to do, federal immigration falls very squarely under the federal government's purview. So what can you do and when will you know if more is needed?
So I think the state's in a good spot currently, but will the feds reach in directly? I assure you they will, and we're going to be watching.
All right.